Hello, happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, emergency medicine doctor in Los Angeles.
Yes, and we are coming toward the end of our summer and getting ready for school to start. A lot of schools, districts have already started online learning here in LA County. And if you want to know more information, please visit my website, Health and Healing Direct Primary Care, or healthandhealingdpc.com, or my Facebook post or page, Ostick MD, for more information about COVID-19, the pandemic, what's been going on, different topics that we've addressed along the way. Today, I want to talk about what makes you a close contact. As we start to open up, especially with schools, even with remote learning, people will be maybe on campus more, at your workplace, as you start to go back to work, as you start to maybe have more gatherings. What makes you a close contact? We talk a lot about that, and if you look on LADPH or CDC website, there's specific criteria as to what makes you a close contact and what you should do if you are screened positive for that or negative, depending on the situation.
So if I walk past somebody with COVID, is that considered a close contact?
No. Right? So there are very specific rules about this, and the reason is not just thrown out there arbitrarily to make our lives easier for contact tracing. It's because what we know about this virus, how it transmits, who's at highest risk for transmission and being more contagious. So what makes you a close contact? Greater than 15 minutes, speaking to somebody within a 6-foot distance with or without masks. They don't make the distinction whether or not you're masked, if you're masked versus you're not masked. Now, if you both are wearing masks, obviously that reduces that risk significantly, but it doesn't matter. If you're within a 6-foot distance, speaking for 15 minutes, and that person, your friend, comes back positive for COVID, you are considered a close contact. Okay?
So anybody that you're living with would be considered
it's pretty much
contact.
Automatic, right? So any household contacts are probably going to fall under that criteria.
Absolutely, yeah. Yeah, and I think, what's interesting is that as we learn more about this, it seems that the viral load that you have gotten from the infected person seems to make a difference whether or not you get the virus or not. Like one virus particle that gets into your nose or in your mouth or in your eyes is probably not going to give you the coronavirus infection.
Right.
Our body can clear that without much of a problem. But if you get a huge load with millions and millions of virus that's like right in your face, that is a much bigger risk. Like if I'm in the emergency department and I'm intubating somebody, meaning putting in a breathing tube for somebody that's in cardiac arrest or somebody that's really short of breath and can't breathe anymore on their own, and we need to put them on the ventilator, that's the highest risk for me during my job.
Yeah.
Because I'm right there in the patient's face, we're in their airway, there's virus particles that are all around that area, and I'm really within 6 inches to a foot away from them.
Yeah.
And so the viral load there is huge, which is why during those procedures we're wearing our PAPR, which is the hood that has its own oxygen supply to try to protect us that way.
Yeah, and actually that is one of the other criteria. So it's the 6-foot, 15 minutes, but it's also being exposed to bodily fluids. So if you had somebody sneeze right on you, even if you'd only been speaking for a couple of minutes, if they test positive for COVID, then you would be considered a close contact.
Yeah, I mean, there'd be a lot of virus within that
on a
sneeze or on a cough directly in your face.
Right, exactly. And you didn't have protection or whatnot. So that makes a big difference because the close contacts, what they have to do is they have to quarantine for 14 days. Let's say what I'm getting a lot of calls are people that were considered a close contact and they want to get tested. And that's fine, and we can test you through that 14-day quarantine, but it is not going to change the recommendation or the status of you being a close contact needing to quarantine for 14 days. You can develop symptoms, and in the incubation period for this virus is 2 to 14 days within that time period, which is why that quarantine time period is there. So if you test negative, that's great, and we're happy, but we're still going to say stay home for 14 days.
So here's the question, though. People are going to say, well, I just got exposed. This was for sure an exposure. Somebody with COVID I knew was right in my face, sneezed on me.
Yeah.
Now I call my doctor. When do I get tested?
Yeah, the literature suggests that by day 8 of your exposure, the test should pick up about 97 to 98% of cases. So in between within that week, you have a higher chance of getting false negatives, which is again the reason for the 14-day quarantine. Because if you don't develop symptoms, then within that 14-day, we can kind of rule out your then you having that acute infection. Or you can get tested. What I would recommend really is day 7 or 8 after exposure, and then we can feel confident that we're really ruling that out. But again, you're still going to need to quarantine for an extra week.
So if you think that you're an exposure, you got a real exposure, probably the best thing to do is call your doctor, talk it out with them, and you guys can come up with a plan of when you're going to get tested. It doesn't make sense to get an exposure that day, call your doctor, and expect to get a test that day. It's really, you're going to likely be negative, and you may turn positive.
Right.
To 8 days.
We can always do another test, but the thing is, you want to make that test as valuable as possible in that moment. Mm-hmm. So by day 7 or 8 from being exposed is going to be that test is going to be the most you have the most sensitivity with that test. The other thing that is interesting, that there's a lot of literature in the beginning of this quarantine is talking about, initially we had, 2 negative tests 24 hours apart to rule you out. Mm-hmm. And once you've had it, and we really have thrown that away because we've seen a lot of viral shedding within up to 3 months of people becoming exposed or having the virus. So the PCR test is so sensitive that it can pick up trace amounts of virus that are not clinically significant, not causing a lot of shedding or symptoms or transmission. So again, you want to have a really good conversation with your doctor about what this test means, what it's going to do for your clinical decision. So if it's because you're ruling yourself out because of an exposure, waiting that week is really helpful. But again, it's not going to change your 2-week quarantine time. And then once you've had it, the recommendation is a time-based recommendation. So it's 10 days from either test result, because if you were asymptomatic, it's test-based, or if you had symptoms, it's 10 days from symptom onset, okay, and then 24 hours fever-free before you can come out of isolation. Yes, you can get checked again. Yes, you can get screened 2 weeks later, but it may come back positive, and what are you going to do with that information? Does that mean you're still transmitting the virus? So I don't recommend retesting. You finish your 10 days out from your time-based strategy, which is 10 days from symptoms, or test-based strategy for 10 days from test positivity, and then after that, your likelihood of transmitting that virus is so low.
And that recommendation is from the CDC.
The CDC and the DPH also follows that recommendation.
That's the Department of Public Health.
Yes, if you are severely ill, hospitalized with COVID, they actually recommend 20 days of self-isolation, including that time that you're in the hospital, because your viral load is really, really high and you're shedding it, and so your contagion is much higher.
All right. Well, thanks, Dr. Ostick. If you are interested and you need to get tested, you think you are an exposure, please reach out to Health and Healing Direct Primary Care. Dr. Mm-hmm. Ostick can talk you through it. Just so you know, she's only testing members currently because of the PPE resources that are really limited, unfortunately, here and across the country. Mm-hmm. So members only for right now, but membership is $89 a month for adults and $39 a month for children, right?
Correct. Yes, we do all of our testing in the parking lot. We have rapid testing available too, which will be helpful through cold and flu season.
So you do the PCR test, you can do that in the parking lot. You do the rapid test, you can do that in the office. You do antibody testing as well if need be.
Right. Correct.
Great. Contact Health and Healing Direct Primary Care at 818-600-2426.
Yes. Take care of yourselves. Take care of one another. Be safe. Stay cool as well.
Wash your hands.
And wash your hands. Bye.
Take care. Bye. Mm-hmm.